Hey everyone, Dr. Luke Peterson here, physical therapist with the Knee Replacement Therapist. In this episode of the Need to Know Show, we're going to talk about same day or outpatient knee replacement surgery. Hey everyone, so today we're talking about outpatient knee replacement surgery. You may also hear this referred to as same day knee replacement, ambulatory knee replacement surgery, all basically the same thing. And what it means is you are having your surgery, your knee replacement surgery, and then being discharged from the hospital, from the facility on the same day. So no staying 2 or 3 nights at the hospital, going in for the surgery, and then that same day you're leaving and going home in most instances. And these usually take place at special hospitals, special surgical, ambulatory, outpatient type facilities. And usually you're there from early in the morning to most of the day, typically around 8 hours or so. So you are kind of monitored for a couple of hours after your actual surgery, but you are still going to be discharged that same day. You're not going to spend the night in the facility. And this is probably a new and up-and-coming trend. It's definitely been increasing in popularity. It was increasing in popularity before the COVID pandemic, and now after COVID pandemic, it seems to be like it's trending upward more and more as, of course, another way to have people spending less time in a facility surrounded with other people, chances of getting infected or having something bad happen. So it's definitely something that's trending upward and becoming more and more common. So some things to think about is this surgery isn't necessarily for everyone. Not everyone is going to be appropriate for an outpatient-based knee replacement surgery. It's going to be your individuals and your patients who are, one, usually a little bit younger, a little bit healthier, someone who doesn't have a lot of comorbidities, doesn't have a lot of risk factors that might lead to potential complications, potential need for further monitoring and checking up on. It's going to be someone who is able to go home and has a good social support system. You don't necessarily have to live with someone, but that does help. Of course, having that social support, having someone there to help you in those few days after surgery. But there are people who live alone who can also have this outpatient type procedure. And it's really those individuals who are invested as well. You need to be invested in this. Obviously, you don't have the doctor there keeping an eye on you those first few days. You don't have the hospital staff, the nurses, the physical therapists, everyone else making sure you're doing okay. So you really have to be someone who is proactive, who is aware of what's going on, who is taking initiative in their preparation and plans for their recovery after knee replacement surgery. And it's really those people who are considered low risk, those low risk patients, if you wanted to kind of boil it down into one term of who is appropriate for this outpatient type service. And of course, what is considered low risk, probably falls on a spectrum, and that spectrum is, they're easing up a little bit more probably now as they're seeing that this approach has been successful in most instances and is working out pretty well. And of course, with the COVID pandemic, wanting to keep people out of hospitals, out of facilities as much as possible, social distancing, things of that nature, it can also be very helpful in that regard. So some other things to keep in mind is you really want to be on top of pain management. So talking with your surgeon, talking with other healthcare professionals, making sure that you have a good strategy for managing your pain after surgery. Again, same reason, you're going straight home. You're not going to be in that hospital where they can help manage it with you and for you a little bit. So you really have to be on top of, what am I doing in terms of pain medicine? What are my other approaches, such as icing, elevation, things of that nature? What are all my strategies and what is my management plan for the pain that is to be expected after surgery? And really, why is this going on? So we kind of talked about some of the whys, but obviously it's much more efficient if you can have someone who has a knee replacement surgery and then the same day discharge them home, so you're not talking about spending 2-3 days in a hospital, you're not talking about going to a rehab facility, and it's just going to be a lot of cost savings, especially for the healthcare system, but also for the individual in a lot of instances as well. And a lot of people seem to be happier going home. They're a lot more satisfied being home. You know, the saying, there's no place like home. No one wants to sit in a hospital. It's not the best place. It's not very homey. It's not very comfortable. A lot of people, you know, are a lot happier and a lot more satisfied being able to go home and being able to start their recovery from the comfort of their own homes. And there's some also things like decreased risks of hospital-based infections, things of that nature. So definitely an up-and-coming trend, something that seems to have a lot of positive benefits, positive outcomes, seems to be working pretty well, which is a good thing. Makes the knee replacement surgery a little more efficient, helps you to be in the comfort of your own home for your recovery. All again it takes is you have to be very proactive, you have to be very involved with the procedure, with everything going on, so that you can help guarantee and increase the likelihood of having a good outcome from having this outpatient type procedure. So that's outpatient knee replacement surgery, same day knee replacement, or ambulatory knee replacement surgery. This has been the Need to Know Show. As always, I ask if you enjoy the videos and enjoy the content we post daily, please click the button in the lower corner to subscribe. And thank you very much for watching, everyone, and take care.